Alright, welcome. This is Celebrity Pharmacology. So today let's continue with our angiotensin converting enzyme inhibitors comparison. If this is your first time of coming across my video, please don't forget to save this video, like and share. Share this video to those that are in medical and pharmacy practice. Now let's discuss Lisinopril versus Ramipril or Ramipril. One thing I want you to know is that generally there is no that is better than the other. It all depends on the clinician or the pharmacist and also the patient's condition. There's the reason why the clinician wants to change. Not that you say lisinopril is better than ramipril or ramipril is better than lisinopril. It's not. There's no thing that makes one totally superior than the other. Um, Now, I'm sure most of us are conversant or familiar with Lisinopril other than Ramipril. Most people don't even know how anything about Ramipril. Now, let's discuss. Let's talk about their mechanism of action. We know that angiotensin converting enzyme inhibitors. The angiotensin converting enzyme, which is ACE, is the enzyme that converts angiotensin 1 into angiotensin 2. Angiotensin 2 is a potent vasoconstrictor and it also causes the release of aldosterone. And aldosterone cause what we call sodium and water retention. So when this process happens, first vasoconstriction, that's the walls of the vessels will reduce, the diameter, vasoconstriction, then increase in the circulation or increase in volume of fluid in circulation. So when this happens, then it will increase blood pressure because there is enough or a lot of fluid in circulation, and also the vessel it's tinier. So when these drugs like lisinopril, ramipril, when they inhibit angiotensin converting enzyme, automatically the conversion of or the formation of angiotensin 2 from angiotensin 1 will not what take place. And when this happens, then since there is no vasoconstrictor, then there will be vasodilation. That means the enlargement of the vessels. And when there is a and when this happens, also aldosterone will not be released. So this will lead to the removal of sodium and water, sodium and water from the body through the kidney as urine. That's their mechanism of action. They have similar mechanism of action. One thing I want you to know is that ACE inhibitors increases what we call bradykinin, and bradykinin it's a vasodilator, so it helps to reduce the blood pressure that way. But they have a general adverse effect, which is dry cough because of that what bradykinin, that bradykinin. Now let's talk about the onset of action. They have for lisinopril is approximately 1 hour. Ramipril is 1 to 2 hours. You see, they have similar or almost the same onset of action. Duration of action is also the same, 24 hours. Then half-life, the half-life of lisinopril is 12 hours. While for Ramipril, Ramipril is a prodrug, a prodrug. So it has to be metabolized into the active metabolite or the active drug before we'll be talking of excretion, before it carries out its effect. So the active form of ramipril is called the ramiprilat, and it's about 13 to 17 hours. That's the what half-life. So the half-life is approximation, please. Approximation. So the half-life of lisinopril and that of ramipril are almost the same. Almost the same. Now, the best clinical advantage, like the advantage lisinopril has over most other ACE inhibitors, and the best clinical advantage ramipril has over lisinopril is that for lisinopril, it is good for long-term use in management of chronic hypertension, heart failure, where you need once daily ACE inhibitor. The dose, like you see that the duration of action is 24 hours, so it's being administered once daily. For Ramipril, although is the same once daily, but the truth is, Ramipril has what we call more established evidence for cardiovascular risk reduction. The research or the discovery on Ramipril, it's more certain. So what I'm trying to say is that as an individual, as a pharmacologist, I have more confidence in Ramipril than Lisinopril in management of hypertension or cardiovascular diseases. Now, the major drawback of Lisinopril is that it's predominantly renally eliminated. So the kidney function has great impact in the clearance and dosing. So if anything like kidney impairment, yeah, automatically please watch how you make use of the Lisinopril. That of Ramipril, it's more complex. That's more complex pharmacokinetics, because we said it's a prodrug that need to be metabolized into the active metabolite, the ramiprillate. So if you don't want, as a pharmacist or as a doctor or as a cardiologist, you don't want much calculation on how drug interacts and drug metabolism metabolizes in the patient, we should not be looking at Ramipril because it has more complex pharmacokinetics. I think we have to move to the next ACE inhibitor. Please, we have come to the end of this very lecture here. We move to the next comparison before we start asking questions. Please, if you like this video, don't forget to drop your comment in the comment section, like and share. Save this video. This is a celebrity pharmacology. Thank you.